All right, so today we will talk about hypertension. And this is a topic that impacts an awful lot of us over the course of our life and has a pretty big impact on healthcare and costs, certainly in our society. So my objectives today are to define hypertension and talk about predisposing factors, as well as review the risks associated with hypertension. We'll go over how to measure your blood pressure, and I've got a good link in here for from Consumer Reports as to accurate or more accurate blood pressure cuffs. I want to try to break down some of the physiology of what's happening with high blood pressure, and then you'll understand some of my ideas of treatment. And then, of course, we'll talk a bit about treatment, including those lifestyle factors, nutraceuticals, medications, all of those things, and then just a summary. So, what is hypertension? Hypertension is defined as abnormally elevated blood pressure. So the pressure represents the blood flow through your arteries. When we measure it, you get two numbers. So we look at your systolic, that's the top number, and your diastolic pressure. The systolic pressure is the pressure at which that blood is pumping basically out of your ventricle. So, and for the most part, out of your left ventricle into your aorta. The diastolic pressure is the resting pressure. So that's your pressure at rest. And it's that pressure between heartbeats. And we need that pressure and that time, if you will, for your ventricles to fill back up with blood in order to push out. So there's several guidelines when it comes to blood pressure, and I'm going to reference the American Heart Association guidelines from 2017. So these guidelines basically say that normal is less than 120 over 80 millimeters of mercury. Elevated is a systolic between 120 and 129, and a diastolic less than 80. Stage 1, systolic between 130 and 139, or diastolic between 80 and 89. Stage 2, you're looking at systolic at least 140, so 140 or above, or diastolic at least at 90. So if you're above 140 over 90, that's definitely hypertension. There is another category that it's not seen too often, but certainly it is something to be aware of, and that could be a hypertensive crisis, and that's when your systolic pressure is above 180 or that diastolic goes over 120, and certainly, like in those cases, people might be having headaches and vision changes and that kind of stuff. So in those cases, that's generally dealt with in the emergency room more often than not, and we try to bring the blood pressure down, but we also want to be very careful of not bringing it down too much in that case. Let's see. All right, so some predisposing factors for hypertension. Age, as we age, our blood pressure will go up, definitely. In terms of sex, male more likely than female, race, African American, people tend to have higher blood pressures. Socioeconomic factors really interesting. So you've got to think about income, jobs, where people live, what foods are available, work schedules. Night shift workers can tend to have more issues with blood pressure, as can swing shift workers, and also ACEs. So those adverse childhood events. So somebody who has had trauma, which we've talked about a lot during childhood, they are more at risk for high blood pressure as we age. So certainly there's some family history and genetics that can play a role in this. Lifestyle factors, really like diet, sodium, sugar, caffeine, alcohol. We'll go into these, and that's how looking at these lifestyle factors that are predisposing helps us get to how do we prevent this or change the course of this. Inactivity, poor sleep, stress. Drugs, so certainly some illegal drugs, and some prescription medications, some of the antidepressants, sometimes hormonal contraceptives, For some people, decongestants. So sometimes when people have a cold and they get Sudafed, their blood pressure goes up, and that's because of that pseudoephedrine in there. And NSAIDs, so your ibuprofen, and sometimes even Tylenol can be an issue for people. Different medical conditions that are predisposing: sleep apnea, overweight and obesity, diabetes, metabolic syndrome. That's a combination of blood pressure, waist circumference, elevated triglycerides. So those are things we're looking at as well. Kidney disease, the kidneys play a huge role in our blood pressure modulation, thyroid disease, and then there are certain neuroendocrine tumors which are less common, but can be predisposing for hypertension as well. In terms of the risks associated with hypertension, I think people are pretty aware of these: coronary artery disease, stroke, heart failure, peripheral vascular disease, kidney disease, and when you go into all the microvascular things too, kind of along with diabetes, you know, eye disease and neurologic disease. So lots of issues with high blood pressure or hypertension when we're not addressing it. So this was an interesting quote that I found: systemic arterial hypertension is the most important modifiable risk factor for all-cause morbidity and mortality worldwide and is associated with increased risk of cardiovascular disease. So high blood pressure is really significant for us to address. So let's talk a little bit about how you measure your blood pressure at home. So number one, choosing a blood pressure cuff. The most accurate is an upper arm cuff. At the end of the talk, I actually have a reference to the Consumer Reports, which I mentioned earlier. And so, you know, if somebody can't find, you know, an upper arm cuff that fits, that works right, that kind of stuff, there are certainly wrist cuffs. And the bigger thing is, I would say, bring those into your provider's office, and for all of you, bring them in here. And we can actually kind of do a blood pressure and check, you know, manually here and check against your automated cuff. So ideally, you're resting for 5 minutes prior to testing. No caffeine, smoking, exercise for 30 minutes prior. You need to be sitting up straight, feet on the ground. Do not cross your legs. You want your arms supported at heart level. And you want to take a couple of measures, separated by a minute apart. And if you're doing right arm and left arm, it is normal to have up to a 10 millimeter mercury difference there. So don't be alarmed if you see that. That's okay. And when you first start taking your blood pressure, think about taking it, you know, like morning and night for like 4 to 7 days. It gives you a good idea of like what is your average and what is your cuff reading and telling you. So this is a bit of a blurry little thing, but I think it was really interesting in terms of looking at, you know, what happens, you know, if you have your cuff over clothing instead of a bare arm, that could change it by 10 to 40 millimeters of mercury. If you're talking, that can raise your blood pressure 10 to 15 millimeters of mercury. If you don't have that arm supported well, that could add 10. If you're getting your blood pressure and you actually really need to urinate, like go to the bathroom first, because that's going to increase your blood pressure. If you're not sitting with your back supported, that can make a difference. Crossing your legs is going to add, you know, an element of increased pressure. And having your feet so that you can have your feet on the ground. Like for some of you, that might not be an issue. For me, in some places, I mean, you guys know, you know, 5'3" and my legs aren't my tall part. So sometimes just being able to find a chair where you can plant your feet flat on the ground, it's super important, because that could add 5 to 10 millimeters of mercury if you're not, you know, just sitting well and in addition to rested. So I put a couple pictures, or at least this picture in here, to think about the size of the cuff. So when you're looking at these blood pressure cuffs for automated machines, you know, you need the bladder within that cuff. So if you have, depending how big your arm is, you want that bladder to go 80 to 100% of that arm circumference. So if you've got a big arm or you're really muscular, you may need that extra large cuff. Like don't take that as it's not a judgment tool. It's just a matter of getting an accurate blood pressure is the important thing to know with that. So those are kind of some ideas around, cuff size and what's important, and how to be, sitting and appropriately take your blood pressure. So let's move a bit into some of the physiology. And so I'm going to try to explain this so that people understanding the basically underlying what's going on, but I'm also not trying to like overwhelm people with a bunch of physiology. But something to think about. When we think about our cardiac output, it gets measured in liters per minute. And maybe if you've had an echocardiogram before where they do an ultrasound of your heart, you know what your cardiac output is. So that's a measure of your stroke volume, how much are you pushing out, times your heart rate. So that gives you that cardiac output. When we're looking at mean arterial pressure, we're looking at that cardiac output. So think about how much blood we're pushing out of our heart times the resistance in our system. So that's where you get that blood pressure from. So if we have disease in our arteries, disease in our kidneys, that can increase that resistance with which your heart is pushing that blood out. So this is just a neat little graph because it kind of shows how we have our cardiac output. It goes into arteries, to arterioles, to capillaries, and then goes into the venous system and returns. How that overlays our kidneys play a role in this, and I'll get a little bit more into this as well as our autonomic nervous system, which we've been talking about a lot, especially around this time of COVID. Like if you're really, if you're stuck in a fear-based pattern right now, or you can't relax, you can see how that can really, it regulates your kidney, it regulates that cardiac output, maybe your heart rate's higher. It can cause more constriction of arteries, like think about when you're fighting and flighting, like you're just like, you're trying to go. And so it changes where the blood flow goes in your body. So to get a little bit deeper into this, I'm going to talk about the root causes underlying hypertension, and then I'm going to go through another graph that is probably a little bit more in depth. But when we think about what's happening at the root of this, so when we think about how our physiology works, and we have to think about micro and macronutrient deficiencies. So if you're not getting enough potassium in your diet, that would be a key thing right now, or too much sodium and what happens. But definitely if we're not, when we're not getting enough flavonoids in fruits and vegetables. But also there's changes in the vascular biology when we start to get into high blood pressure, or we have, stiffening in our vessels, our heart might become enlarged, and there's changes within the muscle. We have a reduction in nitric oxide. Nitric oxide is produced in our body. We can also, things like beets are a really big thing for nitric oxide. Arginine can support nitric oxide, but that helps our blood vessels dilate. So that's really important. Inflammation is often at the root of this. So when we're dealing with health in general, and with most everything, we talk about inflammation and how that's playing a role in things. Oxidative stress. We all have this cellular stress, and we're all creating these reactive oxidative species, and our body, it's just a balance, or do we have enough things to counterbalance that? When there's too much oxidative stress, we get less of that nitric oxide, which then we're not dilating our vessels. And immune dysfunction in the vasculature, which is, we're talking about inflammation again. And kind of at the linchpin, and where when we get into talking about nutrients, there are different ways to support the endothelium or the blood vessel lining. And that's what's really important, because over time, that's where we can get big changes. So not to try to overwhelm anybody, but what I want to go over, and the important things to understand a little bit, are the main neuroendocrine systems that are involved. So we have this is a picture of a kidney. So this is your renin, angiotensin, aldosterone system, and it really plays a role in your blood volume. It plays a big role in our sodium balance. So that's real important. So when things are functioning well, our blood pressure is good. When we're not doing as well, if we have too much sodium in our diet, that kind of stuff, our blood pressure can go up. When we talk about natriuretic peptides, these also help with that sodium balance. One that maybe you've heard about, sometimes if somebody goes into the hospital, they can have basically a BNP checked, and that's often elevated in heart failure, and that happens, it gets released when that heart gets stretched. So, but it also works with that RAS system to help with sodium balance and our blood volume. Endothelium, we kind of talked about a little bit. So that's the inside of those vessels. It's really salt sensitive. It plays a role in the tone of our vasculature. So we can, if we can basically exert control over our sympathetic system by working and supporting our parasympathetic system, we can get that endothelium relaxed. It will produce more nitric oxide and our blood pressure is lower. The sympathetic nervous system, this we've talked about a lot. If somebody's really in that fight or flight mode, it's going to increase our blood pressure. And then our immune system is really important. And this is why sometimes when people get sick, if you end up in the ER or you don't feel good, your blood pressure can be elevated when there's immune system dysfunction as well. So to move a bit into treatment, this came from Nature Review Disease Primers, which is actually really cool article to actually look at, but it definitely goes through the physiology and it's pretty in depth. But when we think about treating blood pressure, the recommendations, as you'll see, everywhere, it's really important that we work on lifestyle. So certainly when you get into stage 1 high blood pressure, we're still looking at it's lifestyle all along. But this helps kind of go okay, well, when do you really need to think about medications? And for us, that's always a conversation that we have in the office. Certainly if your blood pressure is pretty elevated, and elevated, it's not a one-time elevation generally, unless you're way elevated, and we're looking at hypertensive crisis kind of things. Really, it's checking that blood pressure. And if we have an elevated blood pressure on 3 different occasions, that would start to make you think oh, okay, well, maybe the blood pressure is elevated. But certainly there are times when we'll add medications right away, but more often than not, we're going to go into lifestyle, diet, other nutritional things that we can be doing to help address basically those underlying conditions. So in terms of lifestyle, certainly weight loss. If somebody's carrying extra weight, the idea is to get under a BMI of 25, waist circumference under 35 inches for women, under 40 inches for men. If you're smoking, certainly stopping smoking will definitely help. Physical activity, we've talked about this, 150 to 300 minutes of aerobic activity weekly, strength and resistance 2 to 3 times a week. We all need to manage stress and really moderate alcohol and caffeine because those will drive up your blood pressure. In terms of nutrition, really limiting sodium, processed and packaged foods, I think that is self-explanatory. Limiting sugar, especially high fructose corn syrup. And it's really interesting that there's really actually a direct link to obesity and elevated blood pressure with that high fructose corn syrup. And it gets mediated by something called uric acid, which is something that we can measure, which is pretty interesting. Really important to include lots of clean proteins, fruits and vegetables, nuts and seeds. Really helpful is a cardiometabolic food plan, and that's really based on 30% protein, 30% fat, and 40% carbohydrates. Some of the key foods, eggs, fish, garlic, celery, fiber is very important, olive oil, cocoa, beets, green and black tea, seaweed, All of those things have been shown to help in reducing blood pressure. I found this in a study and through the IFM in one of the talks. So blueberries, it just shows that if you have blueberries in a powder and you do 1 cup for 4 weeks, twice daily, it lowers your blood pressure. So it's really cool, and it will impact your genes. And so, you know, the idea that food is medicine, like, you know, and we're probably not going to have a cup of blueberry powder, but you know what, eating blueberries every day is can really help. And I'll show you where lycopene, which is in a lot of red fruits and vegetables, can make a difference as well, which is really cool. In terms of treatment, when we start to look at nutraceuticals, we're really looking at some of the key minerals are potassium, magnesium, and zinc. Vitamins, B6, vitamin C, vitamin D, and vitamin E. Vitamin E has more limited data, some data in diabetics, and with cholesterol, a lot of times I'm talking with people about mixed tocotrienols, and when we're talking about hypertension, we're talking about mixed tocopherol. So it's just different, a different set of vitamin E. So amino acids are real important. We get those in our proteins. Arginine, carnitine, and taurine have been shown to be particularly helpful. And in terms of nutraceuticals, like starting to think about things like flavonoids that are like resveratrol, pomegranate juice is really great. Lycopene, so lycopene is going to come in tomatoes, watermelons, red peppers, papaya, guava. And I'll talk about that again. CoQ10, grapeseed extract, hawthorn extract, melatonin has shown efficacy, N-acetylcysteine, olive leaf extract, pycnogenol, quercetin. That's one we've been talking about as a zinc ionophore when we're talking about supporting our immune health. It's also really helpful in allergies. Probiotics, so focusing on those fermented foods, as well as alpha lipoic acid. And I'll be able to share with you guys so a couple of tables that I'll go through here as soon as I get through a couple more slides. I'll switch the screen and share a couple of tables with you that I should be able to upload the articles to the website in a blog post. So in terms of treatment for medications, you know, there's lots of drug classes that we use. And I'll be able to show you actually a pretty neat table that kind of compares all these meds and which specific foods do similar activities, which is really neat. But we have diuretics. People know those as water pills. ACE inhibitors, that's like your lisinopril or ramipril. A lot of people have heard of those. Angiotensin receptor blockers, that's the level that you go up to if you get too much cough with an ACE inhibitor. Beta blockers we've had for a long time, those slow the heart rate down. Calcium channel blockers, there's a couple of classes of those, and we can be looking at them in terms of slowing down heart rate or causing more vasodilatation, which reduces that pressure that the heart's pushing again. Central alpha agonists are going to actually decrease that sympathetic activity. Vasodilators, that's going to dilate those basically blood vessels, which allows the heart to pump against less resistance. And then there's another class that's not used as much called direct renin inhibitors. And the direct renin inhibitors, the ACE inhibitors, and those angiotensin blockers or ARBs are all really focused at the kidney mechanism. Yeah. So some combinations of medicines and looks like I got a typo, nutraceuticals. Pycnogenol with ACE inhibitors has been shown to be helpful. Our lipoic acid with ACE inhibitors is helpful. Vitamin C with calcium channel blockers is helpful. Garlic with ACE inhibitors, diuretics, and beta blockers. CoQ10 with ACE inhibitors and calcium channel blockers. NAC, which is N-acetylcysteine, which we've talked about in terms of immune support, is helpful with arginine. And then lycopene, which we talked about before, that all of those foods, and a lot of times those are red things minus, you know, guava, papaya, grapefruit, but lycopene-rich foods can be really helpful. And I think with that, Uh, so in summary, and then I'll switch screens here. In summary, we can control many factors related to hypertension. Certainly diet and lifestyle factors, I'd say, are superior to medications, and medications aren't sufficient without that combination of diet and lifestyle changes. So many times medications certainly will help us. They're going to control that blood pressure. What we can do with diet and lifestyle factors is focus on the inflammation and the endothelial damage and some of those underlying things to stop the damage. So blood pressures will help, certainly bring our blood pressure medication will bring your blood pressure down. But if we can work on some of those underlying mechanisms, that will help as well. And so targeted foods and nutraceuticals can be really helpful with those things. And with that, so here's the list of references to share with you guys. And then I'm going to pull up 2 other things if I can figure out how. So this is pretty interesting. So 2 of the articles that I referenced in here. So really interesting. When we look at some of these different, minerals, potassium, when we look at what were the values in a Paleolithic diet and, what's happening today, there was tons of potassium in our diet years ago. There's very little now. There was very little sodium. There's lots of that now. Fiber, tons of fiber. Our ancestors ate, we eat very little. Protein, they ate more. I think, I find people eat more or less. That's hard to say. Carbs, maybe. I'm going to say we're probably eating more. Fat, eating more. And basically our polyunsaturated to saturated fat ratio, we're way lower than what it was. And then the other really cool thing, so this is what I was telling you about, and I'll figure out how to link this. But so when you look at angiotensin converting enzyme inhibitors, so ACE inhibitors, here are different foods, egg yolks, fish, garlic, gelatin, hawthorn berry. All of these things work via similar mechanism. Melatonin, omega-3 fatty acids. So all of these things help in ways that we use ACE inhibitors. When we get into the angiotensin receptor blockers, we can see, and you'll see as a theme here, celery is a pretty good thing. Garlic's a good thing. Fiber's a good thing. Olive oil, good things. But the angiotensin receptor blockers, we've got a list of things that work similar. Beta blockers, hawthorn berry is like that. Calcium channel blockers, again, like celery. Celery is a good thing unless you really hate it, I guess. In terms of reducing that sympathetic nervous system activities and that via those central alpha agonists, again, celery, fiber, garlic, protein can help. Vitamin D can work like these direct renin inhibitors, which get used less often. Direct vasodilators, so beets, celery, cocoa, lots of good things. Fiber, garlic again. Here's your lycopenes in green tea and black tea, super helpful. You can also, potassium is really helpful. Vitamin C is helpful. So many things that we can be doing. In terms of diuretics, again, celery, fiber, protein, and then a list of nutraceuticals that can be really helpful. So it's really neat stuff. And in part 2 of this particular article series, so this is written by one of the docs that I learned a lot of my functional medicine kind of cardiology approaches from, is Dr. Mark Houston. And so in this one, he actually has a real nice summary. I'll try to make this a little bit larger. Diet, low sodium, so sodium restriction, making sure you're getting enough potassium, magnesium and zinc, very important. And we know those are important for our immune health too. So you can start to get the idea, these tenets at the root cause of all of these things, they're the same, magnesium deficiency, zinc deficiency, too much sodium, bad fats, it's all the same stuff. Whether we're dealing with high blood pressure, we're dealing with high cholesterol, whether we're dealing with diabetes, all of these different things, like a lot of that root and what's at the base of this is all these same nutrient changes and lifestyle measures that are so important. When we're looking at macronutrients, this is where I get that cardiometabolic food plan from. So 30% protein, 30% fat, 40% carbs. It's a good balanced place to start. From there, we can tweak it. Specific foods that they reference in here, garlic. So garlic is really good. Really important too when you're cooking with garlic. I think a lot of us were taught to like heat up your oil, throw your garlic in there and cook it and then start cooking everything else. Actually, garlic should be added at the end so it doesn't get burnt or highly cooked. I mean, it can be cooked a little bit, but you should really add garlic at the end rather than the beginning. Sea vegetables are really good. Seaweed is great in terms of blood pressure. Again, lycopene, dark chocolate, pomegranate juice, beet juice, sesame, so sesame seeds, sesame meal. Green tea is great, carnitine. And then exercise, aerobic. Dr. Houston is really an advocate of aerobic and resistance. And if you're doing this, he's saying daily, you're not going to do squats every day. You might do, if you're going to do resistance daily, you're going to do arms one day and legs the other day and kind of alternate. And this is where we start to talk about some of these other, weight reduction goals, losing 1 to 2 pounds a week. And, we certainly look at body fat. I would say total body fat below 22% for women and below 16% for men, super aggressive. If I can even help women get down to 25 to 30% body fat, makes a huge difference. If I can get men below 25% body fat, really makes a big difference. Alcohol restriction, a little's okay, too much isn't good. Caffeine, same thing. A little bit is fine as long as you tolerate it. If you know that it makes your blood pressure go up, don't drink it. Some people just don't tolerate it. They feel too anxious when they have coffee. So if you've heard some other health professionals say you got to have coffee, it's really good for your brain or whatever. Well, if it makes you feel bad, it's not going to help your brain either. Certainly, tobacco and smoking are not helping you at all. And meds as needed. And then this goes through, again, a lot of these supplements that we talked about. So really, the cool thing is we have so many things that we can do and that we're in control of in terms of blood pressure. And focusing on these things really is so important, as we know, related to just our health in general, our immune health and resiliency. So that's pretty much what I have in terms of hypertension. And at this point, what I'll do is see if anybody has any questions.